Good evening. The shutdown of Hawaii Medical Center East and West already felt across the island. The city's emergency medical services says both the Ewa and Liliha hospitals are not accepting patients by ambulance and are expected to close their emergency rooms by Monday morning. The city increased the number of ambulance units in Waianae, Makakilo, and Waipahu, and also Nanakuli. A city spokesperson also says Wahiawa General Hospital and Palimumi Medical Center have reached their capacity and are now rerouting to Kaiser Medical Center, Tripler Army Medical Center, and the downtown hospitals until the others are no longer on divert status. But as KITV4's Jane Enright reports, the shutdown of the state's only organ transplant center has patients desperately looking for alternatives.
Paul Bill is one of 420 Hawaii patients waiting for an organ transplant. The life-saving surgery is performed annually on up to 70 patients at the state's only organ transplant center at the Hawaii Medical Center East. After 4 years of dialysis treatments, Bill says he was set to receive a new kidney in January and a second chance on a healthier life.
Without a transplant, I won't live as long as I'd like to.
But HMC's closures are jeopardizing the 73-year-old's future, along with many others relying on transplant surgeries.
Unless other hospitals on Oahu do this, there is none in the Pacific that will.
Bill says he will fly to California for an organ transplant, but the procedure is not promised and timing is critical to survival.
It's a matter of hours, not days, so that if it does come available, I've got to be there, which means I would have to take a flight, 5-6 hour flight to California in order to have the procedure.
The CEO of the National Kidney Foundation of Hawaii says it is crucial to the state's healthcare system to find the organ transplant center a new facility. Glenn Hayashida says Queens Medical Center stands out as a top option, but he says it is a huge commitment for any hospital to take over.
For any hospital to take this on, they are going to need resources, financial resources, to build up the necessary diagnostic equipment, surgical equipment, as well as the professional personnel.
But for the patient so close to a fresh start, Bill says the state must get involved in securing a site for transplant operations.
Immediately, the state has got to get involved. I think Abercrombie should take note of this right now. I mean, for other emergencies, they know how to take care of them. They should take care of this one.
Governor Neil Abercrombie says plans to care for long-term and short-term health care needs are ongoing, but there is no immediate solution to the closure of 2 Oahu hospitals.
And I don't want to put anything out there that would create a false impression. We're working on it.
Shane Enright, KITV4 News.